So I'm going to really simplify the concept of disease or ill health. Regardless of the name, there's thousands of different named diseases, which really, if you go back to the tree analogy that we have, we've got the roots of the tree, we've got the trunk of the tree, and then we've got the leaves of the tree. And on the leaves of the tree, if you imagine the leaves with all these different named diseases and conditions, ultimately, the only way that you're going to help that tree and alleviate those diseases or conditions is to approach things from looking at the root cause. So when it comes to disease and ill health, this is going to be dramatically simplistic, but it's very important to start with simple and then go complicated. And ultimately, most issues are caused by one or more of four basic things. One is trauma. So obviously, if there's a traumatic injury that permanently alters a limb, for example, that person's going to have some dysfunction, likely for the rest of their life to some degree. The other three are toxins, deficiencies, and then infection or infestations. Now, from there are many roots that branch out, right? So you've got toxins, could be biotoxins. These are toxins from living things like mold, parasites, bacteria, yeast, fungus. You've got inorganic toxins like heavy metals, environmental toxins like Roundup, glyphosate, herbicides, things like that. Under the umbrella or the root of infection or infestation, you have this hierarchy of organisms that can live in us and cause problems to our entire system. And in a lot of ways, produce toxins and contribute to deficiencies, right? So at the bottom of the hierarchy, we've got viruses. These aren't even living things. They're basically genetic junk. They're proteins with lipids, and they cause a lot of inflammatory responses in the body. Above that, we've got yeast, fungus, and mold. And then next up from that, in terms of evolution and complexity, we have bacteria. And at the very top of the food chain, we have parasites. And parasites can be microscopic intracellular all the way to many feet long. And they can live anywhere in the body, including even deep in within the central nervous system. When we are taking a functional medicine approach to someone's ill health, chronic ailment, disease, whatever list of diseases, we're going in at the root and we're looking for dysfunction, imbalances related to deficiencies, infection or infestation, and of course, nutrient deficiencies and toxins. So we look for these to help explain further up in the tree why they may have all these diseases and dysfunctions. And if we handle the root cause, the body innately knows how to function optimally. And if there's enough vitality left, the body can actually restore itself and repair itself.